More questions, and I hope you will be here with the break, so that other questions from committee members can be addressed to you. Our first panel is systematic reviews in nutrition, and our two speakers are Stephanie Chang from AHRQ, and the next talk after that will be systematic reviews for dietary guidelines by Eve Esri-Studi and Judy O'Baggy from U.S. Department of Agriculture. The first is Stephanie Chang.
Hi, good morning. Sorry about that. Good morning. Thank you for inviting me here to speak today. I'm Stephanie Chang. I work with the Agency for Healthcare Research and Quality with the Evidence-Based Practice Center program. Hopefully most of you have heard of us. Not everyone has, so I'm just going to take a moment to introduce myself or my agency. So we do systematic reviews on a variety of clinical topics. We work with clinical practice guideline groups, with NIH, with the U.S. Preventive Services Task Force. So we do a number of systematic reviews on preventive topics, treatment topics, delivery organization topics, probably a lot of the reviews that were used in the previous dietary guidelines with the dietary reference intakes as well. So we've had about 20 years experience doing systematic reviews in a variety of different topics. So this was the topic I was given, systematic reviews in nutrition, what's different? There's no question, systematic reviews in nutrition field is very challenging. There's a lot of challenges, and I'll go through and talk about a little bit of framework about what those challenges are. When I came to this field about 10 years ago, what I realized is that there really is no typical systematic review. I think every review has their own unique challenges, and what I realized is that systematic review is not cookbook research. It's really just a systematic, explicit approach to looking at the evidence. And so in that way, I don't think that it's really different, because every review is a little bit unique in itself. But there is kind of a systematic approach that we talk about. So I'll go over that as well. So what is the thing we're comparing it to? So first of all, obviously, I have no financial conflicts of interest. I work at AHRQ. I believe in the systematic review process. These comments are my own and do not represent Health and Human Services. So this is my overall framework. We've been using this slide for many years. I really believe that, how do I do this? Oops, shoot. So the systematic approach is looking at the evidence, but there's also a systematic approach to incorporating evidence into policy decisions. So I think this is important for any policy guideline group to look at how we look at the evidence, and then also how we incorporate the values and resources. And so I put our little logo, the evidence-based practice logo here, because I think that there is benefits to separation of how we look at the evidence, and then how we partner with those who are incorporating that evidence into values and resources. So this is the systematic process that we think that are important. So it's broken down into 6 steps generally. 4 of those which are really in that top area of looking at the evidence, and then the bottom 2 areas are in rolling up the evidence together and making recommendations. So the first step starts with clarifying the question. And so Barbara went through that and talked about, prioritizing the question. But really, it's not just the general question, but really defining the question. And that takes a lot. And her comment about taking 6 months, I think that's the minimum it requires, because that's where everything starts. So defining we use the PICO criteria, the population intervention comparison outcome. What is the question you're looking at? And how do you define that in a research way so that you can look at the research? And then identifying the sources of information that you're going to look at. We talked about the need for observational sites, or what is the appropriate types of evidence that you want to use to answer that question. Critically looking at the quality of each individual study and how much it should contribute to the overall evidence. And then how do we summarize that evidence in a way that is most appropriate for the type of question it is. Sometimes there's not much evidence, so an evidence map is most appropriate. Sometimes there's enough evidence to do a meta-analysis or a quantitative synthesis. Sometimes the data is not appropriate for quantitative synthesis, and you have to just do a little bit of qualitative synthesis. And then there's other types of analyses or summary or statistical methods you can use: decision analysis, cost effectiveness, qualitative comparative analysis. So and that's only a sampling of them. So there's a lot of different types of approach. So people think systematic review, they think meta-analysis, but there are many other ways to synthesize evidence. And then looking across outcomes to judge the net benefits of something, and then translate that for policy. And of course, there's a lot of steps after that as well. So the process of doing the systematic review, obviously the importance of the systematic review expertise, the independence, the unbiasedness, but we also want to have it's not just a cookbook, but you need to really incorporate the technical expertise, the content expertise at specific points along the way, most primarily up in clarifying the critical questions, but also throughout the process of providing context, determining the appropriate criteria, and then through the peer review process as well. So this is just a little bit on our evidence-based practice center approach. You can see at each step we have, so for the clarifying critical questions, we have a topic refinement step. It's a 4 to 6 month process where we work with end users, work with topic experts and methodologists to really, it really requires that back and forth to identify the question that is important to the end user and to the policymaker, but also to define it in a way that can be looked at from a systematic review approach. The second step is the protocol development. Again, relying a lot on the expert input along with the systematic review methodologists. And then the third step of evaluating the quality of individual studies. Again, so for our evidence-based practice center approach, we have a contract with evidence-based practice centers, and we make sure that each individual is unbiased in their evaluation of the individual studies. So they both have to be expert in being able to assess the risk of bias in individual studies, but also unbiased in the content in the field, not have a stake in the game of how each study is going to be interpreted. And same with whatever quantitative or qualitative methods have been determined for summarizing across the evidence. We also have other quality control methods for public and peer review, and for production of the EPC report. And then we partner with organizations such as the DGAC to use the report and make recommendations. So the application, so systematic review process application to nutrition, obviously there's lots of benefits. I don't have to argue with this group. Transparent, rigorous, structured approach. When it's appropriate, meta-analysis to increase power. And then I'd like to argue that the flexibility of the systematic review approach to different types of questions or data to answer them. So I'm going to go over some of the challenges. I think not all of them are completely unique to nutrition, but share some of the challenges we've experienced in many of the other types of reports we've done. We've characterized in the systematic review literature, we talk about complex interventions. And we've put forward a report on this, and we actually have a series of reports coming out in JCE about the challenges of doing reviews in these complex interventions. And I think this is a classic, nutrition is a classic example of this. Common challenges to most clinical topic reviews had dealing with the challenge of heterogeneity of treatment effectiveness. Big problem for any review, again, defining and scoping the questions, and then some nutrition-specific issues. So complex interventions. So what do I mean by this? So this is how we define it. The abbreviation I use is complex interventions. It's really, I think, terminology. People define it differently, and that's what our report talks about. But we talk about complex multi-component interventions. So the fact that an intervention has multiple components to it, it's not just like drug A versus drug B. It's a behavioral approach, or it's a diet, or it's a pattern. It's a delivery of a healthcare organization or a healthcare delivery system or something like that. So there's multiple components. It's not just an intervention in isolation. It's really interacting with the environment. It's interacting with there are many contextual factors that you have to consider. It's something that is individualized. It's not the same for everyone. Sometimes it may require a little bit of individualization to this person or to that person, so it's not always the same thing you're delivering. And then, of course, the fact that these complex interventions go through, it's not a straight path from the drug to effect. It goes through many intermediaries. It may be over a long period of time. It may have interactions between the intermediate outcomes. It may be nonlinear. So all of these are kind of some of the challenges around nutrition and complex interventions in general. So, yeah. So just some examples of these that we've done. So case management, care integration, diet, exercise. So we've done a lot of these. Self-management, mobile health apps, chronic pain management. So these are just some examples of the common messy questions we've struggled with. And this is and the framework that we've come up with for complex interventions. So common challenges, heterogeneity of treatment effectiveness. So this is common to all fields, but I think in nutrition it's particularly relevant, again, probably because of the complex intervention, but also just because of the way nutrition interacts with each other. So the differences in the intervention that you're looking at and how they affect the differences in different aspects of the population, the context, the intervention, and the comparison, and how they may affect the interaction, the nutrient or the food pattern, and the outcome relationship. So identifying these and accounting for these are a challenge in any systematic review. They can be patient needs or resources, they can be policy incentives, they can be the baseline nutrition status, the knowledge or beliefs of the individual, the self-efficacy. Any of these things can affect the intervention and the outcome. So just identifying them and accounting for them in the systematic review is a challenge in any review, but important to be done. So this question of clarifying the question, I think this is we have to start from the very beginning. What is the question we're asking? Are we asking, does omega-3 fatty acid, does a low-fat diet, does it work? Are we asking, does it work, or are we asking why and how does it work? So starting from that, what is the question we're looking at? And that kind of determines how we're going to look at, how we're going to parse out the review, how we're going to look at the question. So this is a framework from the paper we did on complex interventions, and it looks at the different, depending on what question you're really looking at, how you might approach defining the question. So on the far left side is kind of the holistic approach where you're just looking at, where you're primarily looking at, does it work? Do we want to know if something reduces obesity or improves cardiovascular outcomes? So you just look at try to define the omega-3 fatty acids or the low-fat diet as a whole, and look at the outcomes. But on the far right side, if you're looking at more, well, we think that this works, but we want to know how it works or under what condition, then we may use different approaches, such as a realist review approach, or looking at the mechanisms of actions. And in the middle is where we think it works, but we want to know what are the characteristics that make it work. So you might define the intervention differently. You might define it by the theory. So you might say, well, we think this approach works because of whatever biological process it might be. So there's different ways to define the intervention, and how you define it depends how you look at and what information you look for and how you categorize it. So we use an analytic framework, and this is kind of the generic framework, and again, it accounts for the possibility of looking at intermediate outcomes and final outcomes. And I think this still works for nutrition. This is an example of how we did in the dietary reference intakes. I think might be some of you are very familiar with this. But again, it counts for associations, and you can do a systematic review process at any step. You can decide, we already are comfortable with this, or we're not comfortable with this. We know there's not going to be evidence, and so you can break it down to where along the causal chain you want to look at the evidence, and it may be association or it may be causation that you're looking for. Again, an example of the vitamin D and calcium. So what's different about nutrition? I think there are a few differences. I mean, there's no such thing as no nutrition. So defining the comparator, looking at causality versus association and the importance of observational studies. The mechanism of action, again, referring to the fact that it's not all or none, it's a dose response often. Looking at the theory of why something works or understanding that theory, that's very important in nutrition. And then, of course, the measurement issue, which is always challenging. So with the last 7 seconds, so my conclusions. Really the importance of the systematic review process and the approach to forming policy decisions, and that this systematic review provides a structured and transparent approach. The independent review of the literature with unbiased methodology experts can help separate the questions of the evidence from the questions of values or resources, and the importance of a peer review process and public review process to provide quality control. Topic refinement, I can't overemphasize that enough. I know Holger's talking about this later, and so I'm glad he'll be able to delve a little bit more deeper into it, but talking about what is the question, effectiveness versus exploratory, and using the analytic framework to look at the linkages along the way, defining what is the intervention you're looking at, what is the comparison you're comparing against, what, are you looking at intermediate outcomes, what are the linkages, are you looking at associations or causation? And then, of course, the importance of engaging the appropriate and unbiased personnel that are, so both methodology experts that are unbiased, and then appropriate methodology and topical and clinical expertise at the appropriate times. And I think my 15 minutes is up, so thank you very much.
Thank you.